Our goal for these sessions is to give you as much value as possible through insights into the many areas of the NHS and by providing a platform for thought leaders to speak and share their thoughts on the topics that are relevant, interesting, and deserve real debate and conversation. We want you to be able to benefit from the advice, guidance, and reflections from those working in the NHS or with the NHS through practical, actionable tips that you can use straight away, or use the discussions that we have on these sessions to further your own internal decisions and ways of working. With that in mind, I am absolutely delighted to welcome Dr. Gurnak Singh Dosanjh. Dr. Dosanjh attended medical school at the University of Leicester and has been an NHS GP since 2012. He's also the UK head of clinical solutions for Dignio, a connected care solution offering remote healthcare monitoring. He developed his intrigue in digital solutions by creating an app for the recycling industry. His interest led him towards digital health innovation, combining his passion for clinical medicine with his experience in digital technology. And he has since worked on various digital health platforms and projects for the past 2 years. Dr. Dosanjh now works to support CCGs, trusts, PCNs, and clinicians with implementing digital technology into existing care pathways, with the overall aim to improve patient care outcomes. Gurnak, welcome.
Thank you very much for having me.
Thank you for joining us today. We do appreciate your time this afternoon. To kick things off, Gurnak, tell us a little bit about your story and how you got to where you are.
Yeah, thank you very much. So that's a very kind introduction, Mohammed. And a little bit about myself. So I'm a GP working in the NHS. I'm based in the Midlands, and I've kind of been involved in digital health for some time now. And actually, I actually entered it purely by accident. You know, I have a passion in recycling. It's a kind of passion interest of mine, and I kind of started to help a recycling company to digitalize some of their processes. And in doing so, I actually ended up accidentally creating an app for the recycling company. And it really kind of sparked my interest in what digital can do for kind of people out there. And I guess the natural next step for me was really to kind of merge that interest in the tech world and in technology with my kind of natural passion for clinical medicine. And that's kind of how my journey really started. You know, I was then contacted by a very close friend who said, look, we're looking for doctors who understand tech and understand clinical medicine. You know, would you like to join our team? And that's where my kind of digital journey, so to speak, started really.
That's amazing. That's amazing. I suppose, I mean, just thinking about kind of COVID-19 and this kind of really kind of tough situation, what's it been like as a GP in this kind of rather intense periods for the NHS? What's it been like for you?
You know, I think that's a really good place to start off with. You know, COVID-19 has changed everything that we know. You know, it is now kind of almost trying to enter this world of what is the new normal. And even, you know, as a GP, we've had lots of changes. I mean, you know, there's been lots of positives and negatives. You know, as a GP, I think the biggest thing was that it was very challenging, you know, to face something that we didn't quite well, you know, didn't know so well, something that was very new to us, and quite anxiety provoking, you know, thinking about when this all started, the lack of resources, the lack of PPE, knowing whether we were doing the right things for our patients or not, having to change from what was predominantly face-to-face medicine to predominantly remote consulting. You know, almost 80 to 90% of the consultations that I was doing were being done either over the phone or by using, you know, video chat methods. So there came with that, you know, a level of kind of almost like you know, you were scared as a clinician. Are we doing the right things for our patients? But from that, I think came about the positives. You know, I think really knowing that we're making a positive difference to patients at their greatest need, and really being there for our patients, especially the vulnerable patients and all patients, to be quite fair. It was incredibly inspiring, incredibly humbling. The teamwork element of things, you know, not just in primary care, but in secondary care, clinicians coming together, management coming together, is something that I constantly look back at and think, you know, I feel really privileged to be working on that front line. because the support from the top down was there. It was there. Clinicians rallying around each other, people working in areas that they weren't used to working, nurses learning new skills, HCAs, physios, etc., all learning new skills, and the camaraderie that came with that was inspiring. It's something I haven't seen in kind of almost 14 years of being in medical care. And then there was, of course, something else, which was the adoption of change, bringing about digital change and the adoption of digital tools, which again has been a real positivity. So patients and clinicians coming on board with lots of the changes that were perhaps needed to provide healthcare at that time.
Being just thinking about this kind of move towards doing remote consultations, I mean, from your perspective, has it been more challenging for you as a GP to provide patients the quality of care whilst doing things like remote consultations? Has that affected your ability in any sort of way?
I think it's fair to say that it was a big change process. But when we really knuckle down what we do in clinical medicine, the vast majority of how we can help a patient comes from listening to the patient. Close to 70-80% of the kind of decisions that I need to make on a daily basis are coming from just that discussion and listening to the patient. So there are things that you can do when you're face to face with a patient that you sometimes miss when you're talking over the phone and when you're doing things virtually over a video consultation. So some of the small nuances, the way a patient walks into a room, the way a patient may sigh, the way a patient may be avoiding eye contact. So there were definitely some of those challenges, but I think the way that we have certainly been trained to kind of try and help understand what a patient is going through has definitely geared us up to being able to try and adapt our skills to then manage the situation we've been faced in. So I think to summarize, yes, it has had an impact, and doing things digitally has been different. It has been a challenge, but I think on the whole, largely clinicians have really adapted very well to be able to do that and still provide the high level of care that patients need.
And how have patients reacted to these changes?
I think the patients have. I think it's fair to say there's a wide spectrum of how patients have adapted, and I think if we look at healthcare and digital tech in the sense of kind of digital naivety, we in the UK are still quite relatively new to digital changes in the NHS, and the COVID-19 pandemic really sped things up. So it meant that we had to adapt to things very, very, very quickly. And initially, as with any change, there will always be that feeling of, the way that things have been done for many, many years is always a preferred method. Patients will feel a different sense of perhaps compassion when they see a clinician face to face. So there will always be that slight difference in that approach for some patients. However, some patients have really, really valued the changes that have come along. Ease of access, being able to consult from the comfort of your home, not necessarily needing to wait as long in a waiting room because you can carry on with life as you are being at home. In certain sense, so especially for things like remote monitoring, that extra security, that extra kind of comfort that you're being safely monitored at a distance, whereas actually you only get that 10 minutes with the GP. Now you can have a clinician monitoring you, 24 hours a day potentially. So I think there's been, some areas which there have been some challenges to kind of consider, but also at the same time, I think it's been quite nice to see that there have also been lots of positive embracement. And I think coming back to that digital maturity, I think as we progress over time and patients and clinicians start to see some of the benefits that digital tools can bring to the healthcare kind of ecosystem, I think we'll start to understand more and adapt more. And that change isn't going to happen overnight, but I think we're starting to see that change already.
That's really interesting. And yeah, is there a just thinking about those who are perhaps older people who are perhaps not as in tune with technology, has it been quite hard for them to embrace this new kind of world?
I think age isn't really a barrier here, to be completely honest, because we kind of sometimes assume that age is an issue for technology. But if you look at it, I mean, I often look at my dad, for example. He is someone who is completely digitally naive. Up until a few years ago, he didn't know what an app was, to be quite honest. But the tools that are out there now are so user-friendly and so patient-friendly that actually even someone like like my dad can pick up an app and completely understand it. And he's often my go-to. So when I say to dad, have a look at this, how does this work? Do you think you get it? And if he understands it, I think most people will probably be able to understand it.
Yeah.
And certainly, and we're going to touch on this a little bit later on, but certainly with some of my work with Dignio, we have patients who are in their 80s and 90s using the platform and very comfortably on their own devices. So it's incredibly inspiring to see how perhaps some of the older population have embraced those changes. But part of that is due to the fact that a lot of the tech is quite simple to use and is intuitively designed to be so.
That's really interesting. Just on that note, you mentioned earlier that the aspiration towards being able to monitor patients 24/7, and this kind of move towards preventative care that we'll kind of want to try and move towards. What do you think are the main sort of challenges that primary care and community care sort of will face as we try to move towards this kind of preventative care kind of way of working?
Yeah, I mean, I think the biggest challenge at the moment that we are faced with, or certainly will be faced with in the near future, is the fallout from the COVID-19 pandemic. Unfortunately, a lot of the routine care that we would be offering patients isn't happening to the same intensity. Clinicians are managing the kind of the important parts, not necessarily the important parts, but managing the COVID-19 pandemic. So a lot of clinicians are focusing on the vaccine program, for example. Lots of clinicians are focusing on managing the unfortunately very poorly patients that are in hospital at the moment. And what that means is that some of that routine care, which would normally be provided, is getting pushed back. And when the pandemic, starts to kind of come under control a little bit, so a lot of that routine care that has kind of been missed out and perhaps delayed will start to surface. And that's the COVID-19 fallout. And that there have been, I've spoken to patients who haven't come to see me because they didn't want to put extra pressure on the NHS. I've had patients who have been fearful of going to the hospital because they didn't want to pick up COVID-19, or fearful to come and see a clinician because they don't want to pick things up. And then we've also got, another big challenge is the mental well-being of patients and clinical staff as a fallout of COVID-19. So I think these are the biggest challenges that we're going to be seeing over the next few years. But I think that makes preventative care all the more important. I think we need to be using the digital tools that we have at our disposal to detect changes earlier. I think we need to look to see how we can change the way that we manage these patients, and looking at that, at improving that care journey for the patient, focusing on, as well as we can, the prevention more than the cure. And we can do that now. This isn't a challenge that we're looking at in the future. The future is here now. We can focus on this stuff. It just requires that collaboration and that kind of real forward thinking.
It's one of the sort of themes that's going through my mind is, in terms of providers, there's kind of immediate need to find beds, deal with these very poorly patients who have COVID-19, but there's a very big concern about the long-term impact of this pandemic in terms of the amount of routine care, the amount of elective care that was cancelled. And I think it's fair to say that the impact of this pandemic will probably be around for some time, and therefore the need for preventive care is going to be quite important.
Absolutely. And to kind of message, kind of send a message. That doesn't mean that the GPs out there and the secondary care clinicians out there and the NHS, they're not still providing care to patients. That we still are. Absolutely. We're still seeing patients who have uncontrolled blood pressure, who have poorly controlled diabetes, who need their cholesterol managing, all the things that we've been doing for many, many years. But the challenge is that when your focus gets directed towards the pandemic, which is understandably it has been, those things will unfortunately start to build up. And that's where the digital tools will really come into their own when it comes to things like monitoring and catching changes early.
Well, let's go into that a little bit more. So, I mean, obviously, you know, you're a GP, but you've also got a keen interest in tech. And I know you mentioned very early about, you know, it came from this kind of recycling kind of app that you created. Just tell us a little bit more about your kind of fascination and how that kind of was born.
Yeah, again, I think it really just came kind of really out of accident. You know, I've always had an interest in technology. When I was creating, and I actually kind of learned very simple coding to start creating tools, and it kind of grew from there. But you know, the key thing was I knew where my limitations were. So I knew that, okay, this is the point I've got to, and okay, now actually I need to try and focus on other aspects of how I can improvise those or kind of input those digital tools. How can I implement that into real systems? And so then I started looking at things like logistics and workflows, and this was all in the recycling industry, so it had nothing to do with clinical medicine, which is kind of odd.
And that was this before you began medical school? Was that after?
No. This was kind of in the last 8 years. So I was a working GP. This was everything I did in the evenings, quite honestly.
Wow.
So you know, I started to look at those workflows and where were the common issues, the common denominators where things were falling through the cracks. Where were errors being made? How could efficiencies be made? And what I was doing was I was actually building up skills which I could use then in clinical medicine. It's the very same way that what I like to do now is I like to look at workflows and work processes, see how they can be improved, and then look to see where the tech fits in.
That's really interesting. Really interesting. And I mean, so let's if we just talk about Dignio for a second. So
Sure.
I mean, can you sort of share? I guess firstly, if you could just give a more, I suppose, detailed intro, because mine wasn't perhaps doing any justice to what Dignio does. Just give us a little intro to Dignio and what you guys do.
Of course, yes. Yeah. So Dignio is connected care, effectively. So it's a software as a medical device. And to kind of really summarize it up, what it does is it connects a patient with a care professional. So it could be a clinician, it could be a nurse, it could be a HCA, could be a physio, and it combines lots of different health solutions, including things like remote monitoring, including things like medication compliance, consultation, telemedicine, symptom reporting, self-care management plans, all into one platform. So I guess that sounds a little bit complicated, but the idea is that it allows a patient to be effectively kind of own their healthcare, you know, their healthcare process, and be monitored very, very closely from the comfort of their own home or their residence.
Right. Okay. So I guess just practically speaking. So if for example I'm a patient and I'm using Dignio, I'm able to essentially track my progress and where I'm at with various things remotely, wherever I am, and that's fully embedded in the system that the healthcare provider is actually using. Is that right?
In a sense, yeah. So you know, as a patient or a resident, you have the ability to track your, you know, let's say for example, I'll give you an example. With regards to blood pressure, for example. So you're in the comfort of your own home, you need to have your blood pressure monitored. You can keep an eye on what your blood pressure is doing, but more importantly than that, Dignio gives you some increased responsibility. So if your blood pressure goes up, we can actually change the parameters and say, okay, now you also need to monitor your heart rate. And now you also need to start doing this sort of exercise. And that's the patient-facing side. But on the clinician-facing side, they can actually see what your blood pressure is doing, and they can monitor your health. So one of the examples where we used at the moment, and we're going to be talking about this, is the COVID-19 virtual wards, where a patient's oxygen, heart rate, temperature, breathing, symptoms, all of these things can be monitored, and a clinician can say, okay, look, this is not looking so good now. Now we need you to do this. Another example is in the care home setting. So in the care home setting, you may have residents who perhaps are not feeling so well, and that can be monitored. So things like how much they're eating, whether they're feeling a bit under the weather, whether their mobility is not as good. And that can again be monitored by a clinician, and the patient can then, or the resident can then be moved forward and backwards to say, okay, well, look, actually, now we need to do some further monitoring. Now we need to check the NEWS2 score to look for signs of early deterioration. So Dignio as a platform is incredibly versatile. I think that's the first thing to mention. And it can be used in a wide number of ways, which is part of the reason why I kind of helped join their team, because to really help clinicians understand how it can be used to try and help the clinical care pathways even further.
That's really interesting. And in terms of, I mean, is the idea to also try to, I suppose, release time from patients and from staff? As in, is the idea to kind of reduce the amount of times patients have to come in to see a GP and take up time from that perspective as well?
So yeah, absolutely, it certainly can be. So for example, you may have someone who needs their blood pressure monitoring, or it may be something like COPD, or it may be something like diabetes. And in the traditional context, what would happen is a patient would go to see a nurse or a healthcare assistant or a doctor to have those physical parameters checked. And how is the patient doing? What has their blood pressure been like? What have all these checks been like? What have their symptoms been like? With remote monitoring, what you can do is you can remove that step, have all of that inputted in from the comfort of the patient's home, and you can have a clinician sitting remotely managing all those patients. And the beautiful side of it is that clinician could be sitting at a place where usually the patient wouldn't be able to even access. So it may be in a hospital which is, many miles away due to transport issues or logistical issues. So yeah, absolutely, it can definitely, one of the benefits is that it can certainly save time for both clinicians and patients.
And how does the monitoring work? Is there like do you wear a watch? Is something you wear? Like what's the input method, if you like?
Yeah, so I mean, there's lots of ways that input methods can be happened. For Dignio specifically, what we tend to use is Bluetooth integrated devices. So you pick up an oxygen saturation monitor, for example, which is already integrated into the platform. You connect it onto your finger and it will automatically take the reading. But you can also do it manually. And there are also kind of symptom checkers. So you can create questionnaires which will ask a patient certain specific symptoms. So you can ask about things like, how many times have you vomited? Have you had diarrhea, for example? Do you feel breathless? And all of these things can help build that picture up. So there's a number of different ways that you can input. Things like watches, that they have their own place in the kind of monitoring, but Dignio specifically makes sure that it's something that's kind of a validated tool, if that makes sense.
Of course. Okay. And I know we briefly touched on this, but just think about technology and trying to implement it more in healthcare. From your perspective, are you able to just to share some examples or cases where you've actually managed to implement it?
Yeah, absolutely. I mean, there's been lots. So very fortunate to have joined a company like Dignio, who have been around for a very, very long time. So Dignio is originally a Norwegian company. They've been around since 2013. So, 7-8 years of experience in actually managing patients. And I think the biggest evidence that we have was an independent evaluation by the city of Oslo, where they actually looked at the benefits of using remote digital monitoring. And it demonstrated things like a reduction in hospital stay duration, a reduction in the frequency of hospital admissions, and also, just as equally important, that experience for the patients. Patients reported that they felt safe by having someone clinically monitor them. More locally, Dignio has been used in Greater Manchester and the West Midlands, where it's being used for long-term conditions and COVID-19 virtual wards. Coming back to that COVID-19 virtual ward situation, COVID-19 is a scary, scary situation for so many people. And the patients that are using the system have reported that, having a clinician monitoring your symptoms and your signs has been a really part of that journey for them. whereas a lot of patients may feel very isolated, that they've got this very scary condition which can make you very, very unwell, and they have no easy way of accessing a clinician short of phoning 111 or their GP or 999, where they may have some anxiety about how they're feeling. But actually, by implementing digital tools, and I think we'll talk about this a little bit later on, especially with the COVID virtual 19 wards, but by implementing those, you can really offer the patients that a higher sense of confidence that they are being monitored, they are being looked after, especially during this very, very challenging condition that they may be faced with.
I've got a question here from Omar. The biggest challenge when monitoring patients remotely is engagement, compliance, and retention. What kind of stats are you seeing with drop-off rates, and what are you doing to address these behaviours?
Sorry, could I just get you to repeat that a little bit, please, if that's okay?
Yeah, of course. Yeah, sure. The biggest challenge when monitoring patients remotely is engagement, compliance, and retention. What kind of stats are you seeing with drop-off rates, and what are you doing to address these behaviours?
Yeah, so I mean, I can definitely talk for on behalf of what we've seen with Dignio. So compliance rates and retention is actually very high, especially in the COVID-19 virtual wards. I think there's the key thing is to make sure that the setup is got two main components. One is that it needs to have the clinical aspect of it, and making sure that the clinicians that are taking part in that process are engaged. And I think we'll probably touch a little bit about this in some of the kind of overall challenges when it comes to implementations. But the other aspect of it is ensuring that things are patient-centric. And a lot of the times why patients leave these digital tools is because they perhaps don't see the value in it, and they don't see what it's actually, how it's benefiting them until a time that you can actually demonstrate that, yes, this is how it is helping you. And what we've particularly seen in COVID-19 virtual wards, because there is such a close engagement between the clinician and the patient, the patients, they're not dropping off until they feel better, because they're concerned. There is a real need for this specific monitoring for them. They see the value in it, so they can see that, okay, look, this is what my oxygen levels are doing. And not just that, but it also gives, again, a sense of patient education. When a patient sees that their oxygen levels, again, are 98% and their heart rate is normal and their temperature is normal, it allows them the confidence to feel that, okay, I don't actually now need to contact the clinician. But when they see a change, they know that there is a clinician there who can then help them out should they need it. And that can be done very rapidly, either through a chat function, it can be done through a video consultation, it can even be done via a telephone call. So I think the patients that have used the service so far, I think that's one of the real strong points that they come back with, is that level of confidence that it gives them. So actually, we haven't seen such an issue with retention at this point in time. Okay.
What prevents, from your perspective, what prevents user adoption? What are the key things that you would highlight, kind of suppose makes it a little harder to embed technology?
Yeah, I think we spoke a little bit about that to start off with in that last question. So thank you to Omar for raising that. The first thing is we have to demonstrate the benefits to not only the patient but also the clinical team as well, and that really improves the buy-in. And that's the first challenge. But we then have this second step, which is there is still an inherent fear of technology. That isn't just patients, it's also clinicians. People are feeling, is this tool that you're showing me, is it safe enough? Is it difficult to use? Will I be able to use it? Will my grandparent be able to use it? And until you see that process of how simple things can work, I mean, I mentioned that it was literally, Bluetooth integrated. You put something on your finger and it's done, and that's it. Until you can demonstrate that, and until clinicians and patients see that, it does affect that user adoption. So there's definitely a challenge on people like myself and other colleagues who are working quite hard to show the clinicians and the patients the ease of use, and to kind of maybe dismiss some of those fears. Other things, and I think this is one of my real challenges. One of the things I work really hard on is interoperability. How do the tools speak to each other? And one of the things that clinicians are often saying, and even myself as a GP, is often I can have 3 or 4 different pages open, all trying to do a slightly different thing. And often what these things don't do is they don't talk very well to each other. And so one of the challenges, and this is something that we work very hard on in terms of improving, and certainly even in Dignio, we've worked incredibly hard to improve that. I think we've got to a very good point with it. But it's the way that we engage with other kind of systems out there. And then finally, one of the big things that a lot of the clinicians come back to me and they say in terms of user adoption is what about the finances behind this? Who is going to pay for these new changes? Where is that financial money going to come from? And the lucky thing is there are pots of funding that are out there. So specifically for COVID-19, there was a lot of funding released for oximetry at home. Now, the way that that's done, the methodology that's done is up to individual CCGs. But I would strongly suggest looking at those CCGs that have implemented digital tools to create COVID-19 virtual wards, and something that we've done, to see what their methodology is and how they've changed their processes to ensure that they can be as efficient as possible. So I think there's still some work to be done there, but it's going in the right direction.
Just on the point about CCGs, I mean, how do you? I mean, I presume that there's always a bit of focus on payback and how what the ROI would be. Is that a challenge that you face, and how do you how do you go about trying to trying to show that?
I think this is a really important question, because I think that providers, it's fair to say that there is not an infinite pot of money. And we all recognize that the NHS is stretched as it is. So whenever a CCG or a trust is looking to invest in a new innovation, quite rightly, like you identified, there is always going to be a focus on the kind of the return on investment, if you will, and making sure that taxpayers' money is used efficiently. And I think that's incredibly important to recognize that. But the way that I often kind of look at this is that the focus needs to be on the patient first. And my opinion is that will naturally lead, if you put the patient at the core of your project, your technology, your service, if you really put the patient at the core of that, naturally it will lead to the most efficient use of that taxpayer's money. The technology itself, it needs to contribute towards the sustainable healthcare kind of ecosystem, which is why it's really important to get the providers on board. But naturally, when the patient's at the center and we start talking about things like improving self-management, improving confidence, improving anxiety, improving care pre and post-admission, making sure that the right patient gets seen, gets the right care at the right time, and making sure we can prioritize these things. All of these are things we can do with digital technology. These are all things that we're doing right now. And all of these things will improve efficiencies. They will lead to better workflows. And inevitably, that is going to be the return on investment there and then. If you can reduce a hospital admission, or if you can avoid an unplanned hospital admission by carefully monitoring a patient at home, that is going to save the taxpayer money. That is going to save the CCG and the trust's money. If you've got a patient who's particularly concerned about their health condition, let's say for example COVID-19, they are feeling worried, they're feeling anxious, they're scared, they're not sure what to face. It's something that's new to them, and the natural inclination may be to ring 999. Okay. So along comes an ambulance. Ambulance does an assessment. They may be on the borderline, they're not quite sure. The patient goes to hospital for a second assessment. And at that second assessment, they may get some more further monitoring, and the clinicians may say, okay, look, nothing further to be done here, keep an eye on things. Now, if we replace that whole process and monitor a patient in the comfort of their own home and have a clinician on the other end who picks up the phone and says, hey, look, I understand you're feeling unwell. Let's check your oxygen levels. Let's check your heart rate. Let's check your temperature. Let's recheck it again in half an hour and let's see what's happening. That can help with that patient anxiety that may come, which in itself is an avoided hospital attendants. So that's just kind of one example of how, you know, the fundings can be used in more efficient ways. But yeah, there's, you know, it's very important that we highlight that yes, these things can help, but it's about looking at the methodology. And I think, you know, I think we kind of talk about that, or we plan to talk about that, but it's quite important to recognize, you know, are we putting tech into a process which doesn't work well already, or are we going to create a new workflow process and use tech to support it?
Such a good point. Yeah. I mean, what's your view on that?
You know, for me, I think my view is that the methodology comes first. You know, there is lots of tech out there, and you can attach tech onto processes that may not be working very well already, and they become an add-on, they become an addition. So, you know, let's say, for example, a GP surgery has difficulty in managing all of the patients that have blood pressure problems because they've not got enough nurses to do it. If you add on a tool to that and you say, right, we're going to improve the monitoring of the blood pressure, that may not itself necessarily work. What we have to do is actually look at the workflow processes to see where the improvements can be made, and then make sure that the digital tool supports that process. And I think that's where really, you know, we need more clinical digital leads out there. You know, so people who can perhaps bridge that gap between the clinical world and the tech world to really help that process become more seamless. And that's where my kind of role does come in. You know, so that is what I'm doing on a regular basis, is helping the clinicians understand where their workflow and the process may be limiting them, and where the tech can come in to try and help it, not just so it's an addition to the service, so that it becomes part of the service. It becomes integrated, it becomes the service. And I think that's where sometimes we're noticing these pitfalls and slight issues with that adoption process.
It's certainly a theme that we often address with our own clients is, you know, sometimes you have to address the underlying behavior and culture and the way that things are managed before you start looking at technology, because technology isn't always the complete answer. It has Absolutely. To be, it has to be complemented. I mean, there's no point in having a new software or a new tool if I'm not going to bother, you know, using it. And so if you kind of change the kind of behavior and the culture, sometimes, you know, we often go into various trusts, and the first thing we'll say is, well, let's start counting things, you know, because often there's a kind of the culture and behavior is, we're so busy. But what does busy look like? What you know, how do we define that? Let's get the behavior and culture right on that front before we start to look at how we can. And it's an ongoing conversation.
It is, and I think, you know, I think it's fair to recognize that, you know, the clinical world is challenging. It's constantly evolving. You know, it's always evolving. Alongside that, tech is also constantly evolving. So what we can do now, you know, perhaps we couldn't do 5 years ago. But in the same way, what we know about the clinical world now, we didn't know 5 years ago. So these things are constantly evolving, and tech and healthcare doesn't necessarily sit very well together. You know, they're two very different ecosystems, if you will, and they don't always merge very well. So a lot of the challenge really is about making that bridge between the two worlds. And I think that's, you know, that's part of the challenge that we definitely work on, and making sure that culture change and that mindset change, it comes hand in hand with that.
I've got another question here. How do you ensure that patients at home use the devices correctly? And then I'm sure we've covered a little bit of this already, but if you mind just kind of covering off, it says here, being used correctly and the measurements are being taken correctly.
Sorry, I just missed that second part there, the question. I got
Sorry,
the
yeah.
first
part. So it's how do you ensure that patients at home use the devices correctly and that the measurements are being taken are actually correct?
Yeah, very, very good question. So I think a lot of this comes down to the patient education side of things. It would be very difficult to just, because of what you've just said, to kind of send home to a person's house an oxygen meter and a thermometer and say, here you go, off you go, you'll get it right. If I think back to the first few times that I was checking temperatures way back as a medical student, I just wasn't getting the angle right. So there has to be, and again, part of that workflow process, there has to be an element of patient education in that. There has to be an onboarding process for the patient, so they kind of have an understanding. And there has to be that kind of patient education aspect within that workflow. And that can come in a number of ways. It can be with patient leaflets, it can be with videos, it can be with demos. There's lots of different ways of doing that. In terms of the second step of the process, there's always a possibility that the reading may not be accurate or may not be right. And that's where the clinical team come into their own. So what we're not talking about here is, some kind of artificial intelligence, which will say, this patient's oxygen levels are now 89%, dial 999 automatically. We have to look at the workflow process, because that in itself will just generate more work. Because as you've quite rightly identified, perhaps the patient hasn't put the oxygen monitor on right, or maybe they have put it on nail varnish, for example. Maybe their hands are cold. So there has to still be that clinical step. And so looking at a workflow process, particularly with COVID-19, what we would do is if the clinician detected that there was, and this is just an example of one of the use cases, but if the clinician detects that the oxygen levels are low, it would trigger a warning that that patient needs a clinical assessment rapidly. And that can happen via a phone call or via a video consultation, where a clinician can then assess the kind of further clinical parameters, including a clinical history and an assessment virtually over the phone or via video. And they can then talk that patient through the next steps. Now, it may be that, yes, the reading was just inaccurate because it wasn't on for long enough, or they did it on nail varnish. So the clinician can then guide them through that. And what happens at that process is then the patient also learns that, okay, yes, that is something I now don't need to worry about. I need to make sure I don't do it on nail varnish. I need to make sure my hands are warmed up. The challenge with some of the oximetry kind of at-home programs at the moment, where they don't have that regular clinical input, is if the patient checks their oxygen and it's low and they've not checked it accurately for whatever reason, that may end up being a 999 call because they've seen an 89% or an 87% and they panicked and they've dialed 999, and that's actually increased the workload. So this is why it comes back to that initial kind of conversation we've had at the beginning. It's about looking at the workflow process. It's about the methodology that goes beyond the digital tech and then implementing the digital tech into it. So I think it's a little bit of a reoccurring theme there.
I hope you don't mind us going back a little bit just on the COVID-19 virtual wards. Tell us a little bit about that and what some of the stuff that Dignio does with regards to that.
Yeah, I mean, it's not. So we've got the COVID-19 virtual wards. I think that's a very good example, but it's not just COVID-19 virtual wards. You could theoretically have a virtual ward for any condition. And actually, I think this is something that CCG's trusts and the NHS on the whole will be looking at going forward. But let's imagine the difference between a physical and a virtual ward. And I'm very sorry to kind of some of the listeners who may, this might kind of sound like sucking eggs, so I do apologize for that. But if you imagine a physical ward, you have physical beds on a ward. You'll have nurses assigned to that ward, perhaps let's say one nurse for 6 patients. And that nurse, amongst many of her other duties, or his or her other duties, my apologies there, I should say, is that nurse will be checking things like the physiological parameters, so checking things like pain, temperature, oxygen, heart rate, how well a person has been eating, feeling that day, and they will then escalate that care as necessary. Now, the virtual ward is a very similar idea, except it's done virtually. So it's not done in a physical base, it's done in the patients are in the comfort of their own home or in their own residence. The nursing staff will be remote, but the monitoring that you can do kind of face-to-face, or at least certainly parts of that monitoring you can do face-to-face, you can do it virtually. So for the COVID-19 virtual wards, for example, things we spoke about symptoms. So certainly in Dignio, what we would do is, or certainly using the Dignio platform, I should say, what the CCGs that are using the Dignio platform are doing is they are monitoring things like the symptoms. So they're asking things like, how is the patient feeling? How is, is a patient feeling well? What's their breathing like? Then going that one step further, measuring things like the oxygen, the temperature, the heart rate. And then if the nurse or the clinical staff that is monitoring that virtual ward detects a negative outcome, it gets escalated and it gets assessed furthermore. And the advantage of that, the real advantage of that, is the kind of the economies of scale. You can literally have people across a locality being monitored by one clinician. And as I mentioned earlier, the CCGs, they do those daily check-ins, but what they perhaps don't have is that reassurance that the clinician is there at the other end of the phone or on the other end of the chat message, so that the patient can then contact for that clinical advice as needed. And in a way, it's kind of the way I kind of see virtual wards working is that a clinician would receive the same level, or at least as close to the same level of care that they can receive in a physical ward setting, but hopefully still not feeling as isolated by being in their own home. And this is one of the things that we hear regularly when patients get discharged and perhaps they don't feel like maybe they've been discharged too quickly, or they feel like they've got no monitoring. They get discharged from a ward and they're home, and they've gone from having blood pressure checks maybe 4 or 5 times a day and heart rate checks regularly, and a nurse asking them how they're doing, to going into their own home where there isn't a clinician there asking them, even once a day maybe how they're doing. So that virtual ward can really offer lots of benefits, even as a step down place where they're still getting that monitoring.
What about mental health?
Mental health is massive, and I'm really, really glad that you brought this up. And this really goes into the how can this digital tech be used to further support patients? And I think what we need to do is we really need to break it back down to what is illness, and if we break it down to the concept of the biopsychosocial model, there is the biological component of ill health, there is a psychological component of the ill health, and then there's the social element of the ill health. And I'm a big fan and a true believer that what we need to be doing, and we should be doing, is we should be monitoring all aspects of a patient's lifetime. Now, I don't say that in an invasive way. I don't mean that in a big brother way. But if we know that there is an issue with a patient's housing situation, for example, how is that going to affect a patient's mental health? Are we capturing that information? Do we know that immediately, that when a patient presents with chest pain, for example, that's being precipitated by a change in their mental well-being due to anxiety? And do we know that before the patient even comes through the door? And the question is, if we don't know that, why don't we know that when we've got the digital tools that can help us uncover that, and we can find that? Has there been a change in a patient's financial situation? And again, I'm not advocating that we go big brother on this or anything, but these are the kind of things that we could be asking before a patient even presents to the hospital or to the GP surgery in a very subtle manner, to be looking at those kind of capabilities. On a much bigger scale, I think mental health, again, it also, is the digital tools and the digital technology out there just right now at the moment to monitor those changes and monitor that well-being is out there. We just need to use it. And it certainly is being used, but not perhaps at the scale that we could be using it.
That's really interesting. I mean, we've spoken quite a bit about what's currently out there. Let's look to the future, I guess. Now, I mean, where do you see things going in terms of AI? And there's all sorts of kind of fancy buzzwords out there. What's your take on the future?
For me, I'm not a big fan of saying what does the future look like, and I'll explain that. The reason is because I think the future's here now. We've got the technology now, we've got the digital tools now. What we should be talking is how can we change healthcare now? What can we do to actually improve it now? Whereas when we talk about the future, what we tend to do is we tend to kind of kick things along the road and imagine it will come one day, but the tools are there now. So for me, I think what the exciting changes might be in this is as we become more digitally mature, as patients and clinicians engage more with those digital changes, it will allow us to embrace those changes more. And it will allow us to try and help demystify what some of that tech and technology can do. And I think what I'm most excited to see is kind of two things. One is the real cradle to grave approach to clinical medicine. We have that in the form of GPs. GPs are very much cradle to grave. Unfortunately, the way that the kind of primary care is changing now, we perhaps don't do that as much. But there's no reason to say that we can't bring that back to the core functionality of primary care by using digital tools from literally from kind of the maternity phase all the way to the grave, and having one integrated system, or at least integrations into a system which allows us to do that. And the second thing that I think I'm quite excited for is, again, looking back at that biopsychosocial model that I just mentioned, how things like social, finances, housing, how all these changes feed back into the physical illnesses and mental illnesses, and how that integrates into healthcare. At the moment, that's very disjointed. An example would be, there aren't very, very good systems in place for people to be alerted that, for example, a child has been to different hospitals around the UK with the same issue, for example. So that doesn't feed into one system well. And I think those digital tools are there. We just need to start embracing them. I think, we mentioned things like buzzwords, and there's lots of focus around AI. And I think it is a big focus at the moment. And it's very interesting to see some of what is coming through with that. And I think there's definitely a lot of interest in kind of the predictive analysis of disease progression and imaging and diagnostics. And it actually reminds me of a time when I had a chat with some medical students, and they were very concerned that AI is going to take over from clinicians. AI is going to become the next big thing, and doctors aren't going to be needed. But actually, I challenge that. I think this is an evolution of healthcare. If we look back many years ago, we didn't have things like X-rays, we didn't have things like CT scans. If you look back even further, we didn't have things like stethoscopes. Digital is going to be a new way of us managing clinical medicine. I think we need to try and embrace that change. But also, I think, and I mentioned this earlier, we need those digital champions who are clinicians to really take the lead on this. The digital tools that come out, and this is in no disrespect to, the techies who make the tech, but really when a tool comes from a clinician with the patient as the central core of that functionality, in my opinion, they are the ones that will flourish. And having that clinician, or having those clinicians within those teams who are kind of generating these processes, they're the ones that will really kind of, the ones that I'm excited about and look towards and think, yes, we're going in the right direction here.
We've come across so many situations where tools have been forced upon people, and because they haven't played an active part in the development of that tool or that process or that system, it's always seen as an outsider thing. And I mean, for me, when I look back at the projects that I've done, the most successful are the ones where you've managed to get people right at the beginning to say, okay, I want it to look like this. I want this color, that color. I want it to have this drop down. And those are often the best ones. And then they roll out to the other teams. But it happens so often where, you have some guy in some, dark room, someone who just creates something and then said, right, here, go and use it. And those they last about a day or two before it gets broken and it gets shut down.
It's fair to say, that's not to say that these things don't work. And there are lots and lots of things out there where, things are perhaps being developed without the clinicians behind it. But actually what we're seeing now is we are seeing a lot of clinical input. But I think that's the key part here. But it goes beyond just the development side of things. Once the tool is developed, once that tech is developed, how do we integrate it into the existing clinical system?
Mm-hmm.
How do we make sure that it's relevant to what the clinician and the patient need at that time? And that I feel incredibly privileged. This is a massive part of my role with Dignio, and I touched on this earlier. It's really helping make sure that we can bridge the gap between the clinical world and that tech world, help demystify some of those things, but also show some of the exemplars and the advantages of what works well, but also at the same time reflect on what doesn't work well. As clinicians, that's what we do on a daily basis. We're constantly looking at what we've done well, what we've not done well, and how we can improve. And then we make the changes so that we can make sure that those issues don't occur again, or if they're positive issues, that they do occur again. And that's why I do feel incredibly humbled to be in a position where I can actually help clinicians on the ground floor, at grassroots level and beyond, to really implement some of those changes. So I do feel very privileged.
It's amazing. I'm conscious of time. What would your final or your biggest piece of advice be for staff working in primary care or community care or care in general? From your perspective, what would the one or two key things or the key message you would like to kind of push out to them?
I think that the key thing is to try and embrace the technology. I think that's the key thing. But look at what other people are doing out there. There's lots of exemplars out there, lots of best practices, what's working well, what's not working well. And, have that overall understanding that the tech world is constantly evolving and things are constantly improving. But to try and bridge those gaps, I'm more than happy for anyone to reach out to me if at any point. They can do it via LinkedIn or any other methods. I'm more than happy to talk to anyone who perhaps just needs that little bit of support in terms of how the tech would work for their patient and their patient journey, and to try and help point them in the right direction so that they can start to embrace those changes and demystify perhaps some of the fears and some of the challenges that they may have with integrating that tech or creating that change. So that's the kind of key thing I'd mention.
That's amazing. Gurnak, I'm going to just quickly go through one question. Let me just find it from our audience. Where are we? Here we go. Just one here about Dignio and product differentiation. How does Dignio sort of differentiate itself in the market very quickly?
Yeah, I think it's really the methodology. So there are lots of remote monitoring tools out there, but it's the methodology that Dignio really take, and it's about understanding the process and not being a bolt-on. Digital tech to really achieve, and we spoke about this earlier, digital tech and digital tools to really succeed, they have to be integrated into the system. And in my opinion, having that clinical understanding behind it and making sure that the methodology and the adaptations, the change management, the stakeholder engagement, making sure that all those things are in place is probably the key element, which I personally feel differentiates Dignio from perhaps some of the other software providers out there.
Gurnak, it's such a pleasure to have you on board today. It was such a pleasure speaking to you, and thank you all, you guys, for joining us this afternoon. Please do stay tuned for our further webinars. If you haven't already subscribed to our newsletter, that you can do via our website. And if you have any questions for Gurnak, obviously reach out to him on LinkedIn. Myself as well, I'm on LinkedIn as well. Just drop me a message, and hopefully we'll all look forward to seeing you guys all soon. Gurnak, thank you so much for joining us.
Thank you so much for having me. It's been an absolute pleasure.
Thank you. Take care.
I know.
Bye bye.